Hi everyone, I'm Robin, and I would like to introduce you all to Misty Roberts, who is the president of Medical Patient Modesty, a nonprofit organization that works to educate patients about the rights to modesty in medical settings. Misty also developed the website for Medical Patient Modesty and maintains the website. Misty is an expert in this increasingly popular topic of patient modesty. She has brought to light many confusing and troubling issues regarding our God-given rights to our personal privacy and modesty, particularly in the medical setting. It has been a privilege to help Misty by speaking in videos for both Medical Patient Modesty and biblicalmodesty.com, a website about modesty from a biblical perspective, for the past 2 years. Misty is completely deaf, but it does not hinder her at all. In fact, she uses her eyes more than most of us can hear, and as a result, she can observe and see things that many of us cannot see. Misty is not afraid to challenge the medical industry and our culture, and she has written many excellent articles, including Why You Should Have a Personal Advocate for Surgery. Here's a short video of Misty talking about medical patient modesty. You will notice she uses sign language.
Hey everyone, I am Misty Roberts, the president and founder of Medical Patient Modesty, a non-profit organization that works to educate patients and their families about how to have maximum modesty for procedures and how to stand up for their rights to a same-gender team for intimate procedures and how to prevent sexual abuse by medical professionals. We also educate medical professionals about how to be more sensitive to patients' modesty.
Now we're going to discuss gender-neutral restrooms and locker rooms. Over the past 5 to 10 years, some in our country have pushed for gender-neutral restrooms, dressing rooms, and locker rooms. Many argue that it's discrimination not to allow transgendered people to use the restroom of their gender with which they identify, rather than their gender at birth. This is a dangerous agenda that has many consequences. This has opened doors for men to go into women's restrooms at public places and dressing rooms at some clothing stores to prey on women by secretly videotaping or taking pictures of their private parts and even sexually assaulting women. Many sexual predators have exploited the laws by posing as transgendered so they can gain access to women and girls. Sadly, numerous little girls have been traumatized by seeing men's genitalia against their will.
Everyone is encouraged to go to www.biblicalmodesty.com to view the article Gender-Neutral Restrooms and Fitting Rooms. Go to the second button on the left that says Modesty and Nudity. Click on the link that says Gender-Neutral Restrooms and Fitting Rooms. Go to the third paragraph in the article and click on the link that says Bathroom Incidents by Family Research Council to view a list of over 20 incidents that involve sexual assault or voyeurism by men due to gender-neutral restrooms and fitting rooms. There are many unreported incidents, so this is just a short list.
All Christians are encouraged to not give in and stand up against gender-neutral public restrooms, locker rooms, and fitting rooms. Don't let the world desensitize you to this issue.
There is another important issue about nudity before a person of the opposite sex we want to bring to your attention that is rarely addressed by Christians. Opposite sex intimate medical care, especially male gynecologists. This is a huge cultural blind spot. We encourage everyone to go to www.biblicalmodesty.com and click on the link that says, Are Male Gynecologists Biblical? And read that article. The article also discusses the historical progression of gynecology. Most people are not aware that male gynecologists and opposite-sex intimate medical care began in the 1800s after medical school was invented. Before that era, religious doctrine did not allow male doctors to deal with intimate parts of women because it is wrong for a man to see and handle private parts of a woman who is not his wife. Midwives and female nurses took care of women's health issues before the 1800s. In fact, some midwives wanted to get additional training to become doctors, but medical school would not allow women to be doctors, so this is why we did not have female gynecologists for a long time.
We understand this is a very difficult issue because many women have gone to a male gynecologist. I shared around the 1 hour and 10-minute mark of the video Modesty in Medical Settings from a Biblical Perspective that when I first needed a gynecologist in the late 1970s, there were no female gynecologists in my area. I was so grateful when female gynecologists finally became available, and after I found a female gynecologist, I never went back to a male gynecologist again. Our society has encouraged many innocent women to accept a male gynecologist because our culture sees doctors as experts on the human body, and that pretty much anything in the name of medicine is okay, even when it goes against God's word.
Dr. James Heaps, a very talented gynecologic oncologist in California who treated many women for gynecologic cancers, sexually abused many women. One of his victims, Ellen Catter, according to an interview with Elle.com, who believed he was saving her life, shared this: "We've been trained since we were young to trust our doctors, so if a doctor hurts us during an appointment, that just means it's part of the treatment." This is very true. Our culture has trained us to not question doctors because they know what is best for us. This is exactly why so many doctors can abuse patients under the guise of medical care without getting in trouble. Female chaperones usually accompanied Dr. Heaps during examinations. Mrs. Cater shared that Dr. Heaps' chaperones turned a blind eye to the abuse, and she assumed that having another woman in the room meant they were there to protect her from abuse.
Male gynecologists often charm innocent women into accepting them due to their impressive surgical skills and training, professionalism, compassion, gentleness, or even the fact that they may be one of the top doctors in the area.
Everyone is encouraged to check out the History of Modern Gynecology article on Medical Patient Modesty's website. Notice how there was opposition from midwives and even some male doctors in the beginning when male doctors began to do pelvic exams on women. Look at the 1822 drawing of a male doctor tending to a woman's private parts as a compromise procedure on that article when they first introduced male doctors to do gynecological procedures on women. It is interesting how they slowly introduced male doctors to do gynecological procedures by allowing a male doctor to only touch her genitals but not see them because it was wrong. They eventually worked to allow a male doctor to have full access to a woman's breasts and genitals. Our culture often introduces sins into the world by trying to compromise them to make them not look as wrong. While it is great that modern gynecology has brought improvements such as C-sections that have cut down on maternal deaths, surgeries for gynecologic cancers, etc., only women should have been allowed to be gynecologists in the beginning. Medical school made a huge mistake by allowing only men to become gynecologists. Thankfully, there has been a big increase in female gynecologists in the 21st century. Many male doctors, especially male gynecologists, see more women's private parts than most men in our society. We should condemn the practice of male doctors and male nurses handling private parts of women in the same way we condemn allowing men to access women's restrooms and fitting rooms. Male medical personnel are no different than other men who are not in the medical field. The truth is, God has always been the God of moral absolutes. Medical professionals are not exempt from God's moral standards. Look at the list of doctors and other medical professionals according to the news sources that have sexually abused women at www.sexualmisconductbydoctors.com. This is only a short list because most medical professionals get away with abuse without being held accountable. Doctors have a lot of power in our society, and it is easy for them to get away with sexual abuse under the guise of medical care. At least 65 male OBGYNs are listed on this website, which is not a surprise because they perform intimate procedures on women. Take note of the fact that many of the male doctors who have abused women were very well liked in their communities and practiced for at least 20 years. For example, look at how respected gynecologists Dr. Paul Becton and Dr. Nikita Levy secretly took pictures of women's private parts during gynecological procedures. To learn more about both Dr. Levy and Dr. Becton, watch the video Male Gynecologists Secretly Taking Pictures of Women's Private Parts on www.youtube.com/patient modesty.
As for the issue of chaperones for male gynecologists, doctors have a chaperone to protect themselves. A chaperone does not help to protect sexual abuse or prevent lustful thoughts. In fact, many women are sexually abused by male doctors who do intimate procedures on women with a nurse present. A chaperone often defends the doctor when he does something wrong.
There are times a staff member who serves as a chaperone for the male doctor may know that the doctor is doing something wrong, but she may be afraid to expose his inappropriate activities due to the fear of being fired. This scenario of a chaperone distracted as a male doctor performs a pap smear on a patient is common. The presence of a chaperone in the room, even if she does not watch the intimate procedure, helps to reduce liability for doctors.
Think about this scenario. What about a man having a chaperone such as a family member present every time he looks at pornography? Does it make it less wrong? Having a chaperone such as a nurse does not change the fact that a male gynecologist is sinning by handling intimate parts of a woman who is not his wife.
As you all can see, on sexualmisconductbydoctors.com, over 100 family practice and general physicians have been accused of abusing women according to news sources. The reason why many male general practitioners have abused women is because they do unnecessary intimate procedures on women, such as breast exams, pelvic exams, and pap smears. Numerous male doctors have pressured women into having a pap smear, pelvic exam, and breast exam when they came in for another reason, such as blood work, kidney disease, bladder infection, and flu. One male doctor even pushed a teenage girl who came in for a strep throat to have a pap smear.
I remember as a young woman, I consulted a general practitioner for a simple infection or flu, and he asked me if I would like to have a pap smear while there. He talked about how trained he was and that it would save time and money rather than going to a gynecologist. Of course, I calmly and quickly refused.
You will notice that some male gastroenterologists abuse women as they did colonoscopies on them, according to news sources. Women should always use a female doctor to perform their colonoscopy if one is necessary.
We encourage all women to stand up firmly to any male doctor who tries to pressure you into letting him do intimate procedures on you. And just say no. Do not allow his compassion or professionalism influence you. Over 30 years ago, it was unthinkable for male nurses and aides to help women with personal care, such as bathing and dressing. Sadly, with how morals have changed in our world, it is now common for male nurses and aides to help with intimate care of women today. This is why sexual abuse in nursing homes and hospitals have become so common. It's horrible that male nurses and CNAs are assigned to do intimate procedures on women when they could be assigned to male patients.
It is sad that many urology practices in America do not employ any male nurses or assistants for male patients today. Sadly, female nurses and assistants doing intimate procedures on male patients has become an accepted practice in our society. More than 40 years ago, it was a common practice at many hospitals to use male orderlies and male doctors instead of female nurses to do intimate procedures on male patients, such as urinary catheterizations. Many men care about their modesty, but our culture looks down on men who are modest as weak. Sadly, numerous men have been sexually abused in medical settings too. But most complaints by male patients are ignored. Medical Patient Modesty has excellent brochures for men about how they can stand up for their rights to modesty and how to prevent sexual abuse. Go to the second button, About Us, on patientmodesty.org and look for a drop-down button that says Brochures for Men. The video, Problems with Medicine Being Gender Neutral, at youtube.com/patient modesty, discusses how medical professionals often try to push us to accept that the sex of a medical professional for intimate procedures does not matter, and we should focus on their skills and professionalism. Medical professionals often argue that it is discrimination when you do not want any medical personnel of the opposite sex for intimate procedures. We should not let the discrimination argument deter us from standing up for what is right.
We encourage everyone to watch the video Modesty in Medical Settings from a Biblical Perspective on YouTube. This video has a detailed section about history of modern gynecology, starting around the 25-minute mark. This video also has an important section with great insights from a former male gynecologist, Dr. John Smith, who after 24 years of clinical education and practice came to the conclusion that men should not be gynecologists.
Go to biblicalmodesty.com and look for the box on the right side that says View Our Videos, and click on it and you will see the video Modesty in Medical Settings from a Biblical Perspective on YouTube. We also wanted to encourage everyone to watch all of the videos presented by Medical Patient Modesty at youtube.com/patient modesty, especially the video Surgery and Your Modesty that reveals the truth about how vulnerable surgery patients are and what steps patients should take to ensure that their dignity is protected. Some hospitals still have the ridiculous policy that patients must remove underwear for all surgery, even those that do not involve the genitals. Also, some surgery patients have undergone unnecessary intimate procedures such as urinary catheterizations and pelvic exams.
We need to educate as many women and girls as possible about how to protect themselves in medical settings, because you rarely hear about how to prevent sexual abuse by medical professionals. We encourage everyone to get some of the booklets on how women can protect themselves in medical settings from Medical Patient Modesty, and to help us to distribute those booklets. Go to the second button, About Us, on www.patientmodesty.org and click on the drop-down button that says Booklets for Women. Thank you all for watching this video. Please share this video with as many Christians as possible. If you have any questions or feedback, please email us at info@biblicalmodesty.com.